WOWT6. This is Heartland Focus.
Hey, good morning, and welcome to Heartland Focus. Today is a beautiful day. It's going to be a great day. My guest, Dr. Hughes, she is the Director of Health for Douglas County. I want to welcome her to the city and to Heartland Focus. Dr. Hughes, welcome.
Thank you. Really glad to be here.
Well, so you've been on the job, 2 months, 3 months?
It's just barely going on 2 months.
Wow. So just for the viewers that just don't know a lot about you, kind of give us a little bit in terms of where did you come from and a little bit about your why. What's motivating you to do this work?
Absolutely. I would be happy to share that. So I've been in public health for the past 20 years. It's really where my heart has been ever since I was in nursing school and discovered that public health was a field that I could go into. I have been in Nebraska for many years. I was born and raised in Nebraska. I did the first 5 years of my public health experience in Lincoln, Nebraska.
Okay.
Yes, and then spent some time living and working in Colorado and Wyoming, and this opportunity came available. This was really a leadership opportunity that I've been hoping for 20 years, and so we don't necessarily get to pick when our opportunities appear. And this, I guess, was just the right time for that to happen. So here I am.
Yeah, sometimes we don't get to pick. It's just our job to be ready.
Absolutely.
And as you said, you've been readying yourself for over 20 years. Yeah. So as we fast forward in terms of just we're in it, you're one, I commend in terms of your staff and the focus and commitment as we deal with this insidious virus, COVID-19. I really want to kind of do a deep dive in that. So really kind of, if you would say the state of COVID-19, now we have this variant that's popped up, Delta. Give us a little bit of high level state of just really what you have in front of you.
Sure. So right now what we're seeing in our community here in Douglas County is that cases are continuing to increase. And right now we don't see any evidence that they're backing off. So we're continuing to see our case counts increase daily. For instance, today, or from the reports that we got this morning, which would have been from yesterday, we had 208 new cases that came in. When we say cases, we mean positives. So that means the number of positive tests that we had over the past 24 hours. And, 2 weeks ago, it was probably about half of that, or, in the 100s at least, probably like 120 something, and so we've continued to kind of see that happen, to see those increases. We continue to see deaths trickle in. In fact, we had a couple new deaths that were reported just today that we just had reported, unfortunately. We were very sad to see that.
Yeah.
So, we're continuing to see that. Yeah. What we are seeing is that in our pediatric age groups, so basically below 19 years of age, and then in that age group right above that, we're continuing to see the highest transmission, the highest number of cases happening in those age groups, which when you think about it and you think about who's vaccinated, kind of makes sense. We can't vaccinate our under 12 population just yet. So, the virus has to go where it can live and replicate. So that is unfortunately in the unvaccinated.
So when you think about those challenges, especially in terms of looking at the data and it's trending not in a favorable direction, what to our viewers out there, what is our action? Because sometimes I feel like there's so many messaging and misinformation that's out there. Now you have this debate over masks. Should we wear them? Should we not? If you're vaccinated, and should we put them on? Kind of really, what can we do as because at the end of the day, we have to solve the problem in terms of our behaviors and what we choose to do or choose not to do. So what is suggested in terms of best practices, scientific, that we can really put our stamp on?
Absolutely.
Yeah.
So I will say that, before we make recommendations, we really are looking at a lot of scientific evidence. We're, looking at things that universities have studied. We're looking at what other countries are seeing. We're looking at a lot of different pieces of data before we make recommendations. So what that has led us to is vaccination. Of course, if you haven't been able to get your vaccination yet, we have lots of places that you can go to get that. There's not a cost to you. You can get that anywhere.
So just, doctor, just with vaccination, let's pause there a minute.
Sure.
So for the folks out there that's like, they still in limbo of one, the negative effects, is the negative effects of that vaccination outweigh in terms of the risk factor of someone dying? And so really, if the evidence and the gathering of all this stuff, you're basically saying, and I'm hearing a lot of it, is the best defense in terms of this virus is what?
So that vaccination is so important. And the vaccine, anytime you're putting anything in your body, there's always a chance you can have some sort of a reaction.
Right. Absolutely.
I mean, if you're eating shrimp, you could have a reaction to that. There's always a chance.
That's right.
No vaccine is 100% effective, which is true of every single vaccine out there. But this does a really great job of preventing that serious illness and death. And that's what we want. We want to see people not having that serious illness where they're in a hospital bed for a prolonged period and maybe on a ventilator and, God forbid, passing away because of the illness. Over time, from what we have seen so far, very few side effects from this vaccine. It has been very safe. The benefits of getting it really do outweigh, that risk of potentially ending up with long-term, potentially long-term organ damage from COVID vaccine if you survive that infection or if, you come out of that infection. So we definitely suggest that.
Okay.
Masks are a very simple solution. They do not, of course, they're not a magic bullet, so it's not going to prevent 100%.
But there's one level of prevention.
Exactly. So, really what we talk about is a layered strategy. So vaccinate, using masks in indoor settings, especially when you're not vaccinated, although given that we do see occasional breakthrough cases and Delta variant is acting a little different, we're recommending everybody wear those masks in those indoor settings right now. Or if you're in a really tight, even if you're in a really tight outdoor setting, it's really a good idea to still wear a mask.
Regardless if you've been vaccinated or not.
True, yes.
Okay.
Whether you've been vaccinated or not. So those are probably your top two strategies, but other things that you can do, good hand washing, good hygiene, that has been...
3 minutes.
Yes.
Or is it still suggested about 3 minutes or something like that?
When I teach hand washing to preschoolers, I have them sing the happy birthday song through 2 times.
Okay.
And so that is sufficient usually. The big thing with hand washing is the friction. So, you're not just like kind of slapping it on there and running your hands under the water. It's really making sure that you're getting that friction going to dislodge any, viral material that might be on your hands. So good hand washing, keeping your environment clean. Hepa filters actually are being shown to be fairly effective at kind of cleaning the air. So either opening a window, if you can. Obviously in Nebraska, you can't do that for every season. When you can, open a window. Run a Hepa filter if you have one. Those are also really effective things that you can do. And then, keeping that 6 feet of distance when possible. remains something that's important to do. That's not, again, a magic bullet. We're talking about things that you layer.
Yeah.
If you layer these strategies, then the prevention is much, much more effective than if you only use one single approach.
We're going to take a break, but when we come back, I want you to talk about really some folks in terms of behavior-wise, they get the shot, get vaccinated, and they feel like, I'm good. I'm good. I want to talk about I'm good, what that means by getting that shot. How good are you? And really, I mean, you spoke to some of that, but in terms of just some folks have the belief that, well, if I get the shot, I can't catch it. So let's talk through some of that when we come back.
That sounds great.
You guys stay with me. We'll be right back. We have the Director of Health for Douglas County with us, and she's going to share some other thoughts and strategies around how do we prevent and intervene in a way to stop this crazy virus from exploding and really doing even more damage in our community. Stay with me. I'll be right back. Hey, you guys, welcome back to Heartland Focus. My guest, Dr. Lindsay. I'm saying your last name right, Lindsay Hughes? Hughes. Yep. Yeah, Lindsay, Dr. Hughes. Well, welcome to Heartland Focus. Welcome to your new position and Omaha and all that good stuff. So we don't have a lot of time, so most definitely I want to just let you know this always can be a platform as we get into different things and opportunities that we need to do deeper dives.
Thank you.
And explaining what's going on really so we can cause movement and action from our community. And so with that, I'm taking a shot. I'm good. How good am I in terms of just my behaviors? Because I'm seeing some things that people are like, I got my shot, I'm good. I can do this, I can do that. How good are they? Yeah,
so you're pretty good. So you have to keep in mind too that what we are experiencing right now is a little different than what we were going through January, February, March of this year. So, our what you call ancestral strains, so those original strains of this virus that we were dealing with acted a different way than what we have now. So the Delta variant, which is the predominant variant that we have here in Douglas County currently.
Is that the Delta?
Mm-hmm. Okay. Yep, that's right. So the Delta variant is more infectious.
Now, why is that? Because my understanding, and that's not my field, but the mutation, usually the variant is weakened. I mean, it's less. As it mutates, it seemed like this was getting stronger. Does that supposed to? I thought it's supposed to be opposite, where it's not as aggressive.
You can't predict which way a mutation is going to go.
Okay.
And certainly virology isn't necessarily my specialty either, but
right.
The basics that we get in public health. And what we see certainly is that a virus can go either way when it mutates. So with H1N1, if you think back to 2009-ish, when we had H1N1 going around, we actually had a mutation that happened with that virus, and we were kind of holding our breath, waiting to see what that was going to mean. And we were very afraid that, oh gosh, if this is going to be a lot worse, what will that? What's that going to entail?
So you don't know until you know.
Right. So it actually did weaken, and so. Thank goodness, that we didn't end up having to, really have a renewed response around that. Well, unfortunately, this time that mutation went a different way.
Yeah.
It's in a virus's best interest to try to stay alive.
That's right.
Like any organism.
Oh yeah.
So this one happened to mutate in such a way that makes it easier to spread, easier to infect other people. That's just the way it went. So what we're dealing with now and the fact that we have, you're getting vaccinated. We still want people to get vaccinated because it's still effective at preventing that severe disease and death.
And the impact, yeah.
Absolutely. It also makes, if you do catch COVID and you've been vaccinated, there's evidence that it decreases the amount of time that you're contagious to other people. It cuts that time in about half.
Wow.
From what I'm seeing
See,
in the
that's
research.
good. That's good information.
Yep. So, we're having to act a little bit differently despite the fact that we have vaccination, because it's a different, the virus is acting differently. This variant is acting differently. We didn't know that back in December or January when we were rolling out this vaccine, that this is what we were going to be dealing with.
That's right.
And scientists have been watching kind of, okay, how is the virus acting in the population with our vaccinated population, and does that mean we need to do something differently? And so far the consensus has really been, well, it's still preventing that severe disease and illness. Maybe we need to pick up some of those what we call non-pharmaceutical interventions, like masking, distancing,
that layering,
hand washing, picking up those layering strategies again to kind of fill in that gap. Now what will happen is that over time, as we get more and more people vaccinated, and don't forget, we have this population that's not even eligible yet. Our under 12 population isn't even eligible yet. So that's significant. Once we're able to get our entire population in a better place where we have higher vaccination rates, even though we have some breakthrough, we'll be able to decrease that transmission level in the community.
There you go.
So our goal here is not to eradicate COVID-19. I don't think any of us think that's going to happen. What we really want is to get it to a point where we can deal with it. So we don't have,
like the cold or the flu.
Absolutely. Absolutely. So we don't want our hospital systems and our healthcare systems being overburdened. Absolutely. We want our kids in school.
That's right.
We want our businesses able to stay in business and not have all of their workers out. We want life to be able to continue unfettered. So our goal is really to get the transmission level down to a manageable
and to
place.
get back to that new normal, whatever, to where it's manageable. The more people we can get vaccinated and to really practice some of these preventative kind of things, it's going to help us all get back to what we love to do.
Absolutely.
In a way. Now, just real quick, in terms of just once, so you have folks out there, once I get vaccinated, or the whole idea of just, if I don't have that vaccination, in terms of just, it's basically all out of the box in terms of just the impact could go either way. It could lead to death, right? The motivation and the why for getting the vaccination, if you get it, it shortens, I think it shortens the time, the impact, and the possibility of death.
Right.
And if without it, I'm just trying to understand this in terms of layman's terms, without that, if I don't have that vaccination, all that possibility of me really being severely ill is all in play. And so,
Right. Yeah, that's absolutely true. It's certainly possible. We have had young, healthy individuals who have caught COVID and unfortunately have passed away, who haven't passed away, but who have had some really serious long-term complications. So now you're looking at disability, you're looking at an inability to work, you're looking at, a lot of other complications that can come along. So it's not always as simple as just, well, I had a mild case and I got better. Well, that's great. I would wish it would be great if that was the case for everybody, but unfortunately it just isn't. And
really, it's each person. I mean, it depends on how it reacts to your body.
Yep.
No, just real quick, before we go to our last break, Dr. Hughes, talk a little bit about this mask. I know there's a lot of controversy around masking, especially in terms of our schools. What is the evidence and the research saying best practices when it comes to masking for our children that are in school?
Absolutely. So that's a good question, and I actually get a lot of people sending
I know our watchers, right? They're listening attentively to your response on this one.
Absolutely. I get a lot of emails, and I actually read all of them. I want you to know.
Okay,
so looking at the peer-reviewed, the scientists, the people who this is their life's work to do this kind of work, reviewing the research to make sure it's solid, it's done correctly, the research methods are good ones, making sure the rigor is there. They over and over again are really repeating that this is a strategy that is effective. Again, it doesn't prevent every single case.
That's right.
But when you have especially a group of people who are all masking, it increases the impact of that intervention. So, one person wearing a mask in an area isn't as effective as many. And one thing that's important to keep in mind is that when you wear a mask, it is going to provide you with a little bit of protection. So that's good. You get something out of that.
Yeah.
But it's providing even more benefit to your neighbors. So let's say you caught COVID and you don't know it yet. So 24 to 48 hours from now, you're going to become symptomatic. Well, right now you are contagious to people around you. But if you put your mask on, that is catching.
It's slowing it down.
Yes, it's slowing it down.
Yes.
So it is loving your neighbor, basically,
That's
to wear
right.
a mask. And so, again, not a 100% cure-all. It's not gonna, stop it 100%, but it's going to slow it. And again, our goal here is to get that transmission level down.
Transmission level down.
Yes.
And so to parents out there, I think some parents and individuals really, they have a concern about freedom of choice.
Sure.
And I understand taking away, civil liberties and things like that. And so there's a big, hey, it should be my choice if my child should wear that mask all day. But also what you said in terms of just love thy neighbor is more about me protecting you more than me in terms of the spread. And so I think also there should be a choice about how do you protect the environment of a whole lot of folks. So I think we got to take self out of it, and really look at what do we need to do collectively for the betterment of humanity. And this is about saving people and saving lives. We're going to take a break, and I want you to come back with just really, let's talk a little bit about some of our most vulnerable populations and what might we do to really help. I know in Douglas County, the African American vaccination, I think, is still below 40%, and so I want to talk about that a little bit.
Sure, absolutely.
Okay? Hey, stay with me. We're going to take a short break. Coming back, we're going to talk about just some strategies around how are we doing some things to intervene with some of our most vulnerable populations. Stay with me. I'll be right back. Hey, we're back, but we're out of time, man. I gotta have you come back. It's just, there's so much meaningful conversation and information, but let's just jump right in terms of just when you think about our most vulnerable populations, especially Douglas County, so North Omaha District 2, South Omaha, we need more people to take this serious and to really become knowledgeable and educated about why they should get vaccinated.
Absolutely.
Talk to that a little bit in terms of, we're still under 40%. I know the numbers I'm seeing in terms of the African American population.
Right.
But why is it so important?
It is vitally important, first of all, because whatever population you happen to belong to, you matter.
Absolutely.
So it's not okay that our Black population might be suffering, more severe disease or more frequent disease because they're not getting maybe the same access or you know, whatever the issue happens to be. You matter. You should still be protected. So that's the bottom line for me. It's also important because a lot of our vulnerable populations also do have higher comorbidities, you know, heart disease, diabetes, you know, issues such as this that can put you at a higher risk, not just for catching COVID-19, but also for kind of those long-term issues that might come out of that. And so we don't want that. We don't want that to happen.
So when, those comorbidities, especially in terms of the Black population, I mean, when and I happen to be, you know, amongst those numbers because I have diabetes and you know, and I'm dealing with it. And so it's like, it was common for me, it was like a no-brainer that with my preconditions layered on top of that COVID-19, my chances are really become challenged of making it through. So it ain't really a scare tactic, you know, Dr. Hughes. I think is a reality check of, wait a minute, you got to deal with what you're bringing to the table in terms of those comorbidities, so you better figure it out.
Sure, but I would also say, and I just want to interject really quickly, I want to recognize that there's also frequently some trust issues, because here we are, the government saying, hey, get this shot. Totally recognize the trust issues that can exist around things like that with the Black population. And you know, what we could use is champions and voices. So like you know, speaking up and saying, look, this is important for us. This is something that we need to take control of. I want to provide you with the absolute best data and all of the best recommendations. But please help us to put the message out and find, you know, the best locations. I know when we were trying to find vaccination sites in North Omaha, we had a little bit of a challenge because the resources were different. You know, we couldn't find necessarily the great big empty box stores, you know, that maybe we could find in other places. And so we had to work with the community to find better places to do things like that.
They're telling me in my ear we got to wrap. Oh man, it's some great information. But thank you so much, and I wish you the best in that work, and I appreciate you taking the time. That's all for this episode of Heartland Focus. See you next week. Take the time to be good to yourself. It makes it so much easier to be good to others.